guide and support the efforts of our hospitals, our doctors, and our insurers to make healthcare more affordable in our state. Let me now turn to the Health Policy Commission. I am incredibly blessed to be joined by a very thoughtful and values-driven group of commissioners chaired by Professor Stuart Altman. Because we have to be mindful of the Open Public Meetings Law, only a subset of us can be here this evening. Let me note who is and introduce them to you. Starting to my left, Rick Lord from the Associated Industries of Massachusetts. And Rick, please stand. He's really the only commissioner to have served both on the board of the Connector and now on the Health Policy Commission. Mary Lou Sutters of the Boston College School of Social Work. Formerly Did Veronica make it into the room? Perhaps not. Veronica Turner, I'll introduce her anyways because she's an important contributor who was wanting to be here, and I believe there are some folks here from SEIU who's the Executive Vice President of that union. Now, Chairman Altman, who's out of town this evening in a previous commitment, asked me to send his good wishes to you all. It noted GBIO's importance as a full participant in the state's continuing healthcare cost discussion. Professor Altman reiterated to me his strong personal desire that both he, other commissioners, and the commission staff remain in continual dialogue with GBIO and with us as the work moves forward. I now have the honor of turning to introduce David Sells, the Commission's Executive Director. You know, notwithstanding the importance of the roles and decisions of my fellow commissioners, I want you all to understand that really the success of the Policy Commission is integrally linked to the efforts of the staff to creatively carry out much of our docket of work. Our incredibly talented staff are working hard to sort through relevant data and information for policy analysis, to stay on top of our statutory expectations, as well as generate ideas about the best policy and process ways for us to do our job. Their good work on these tasks helps support us as commissioners to critically think through and as needed, cast informed votes on policy matters. David Seltz, as our Executive Director, has the critical job of assembling the team, focusing them, and providing that essential leadership. Now, we carefully selected David because of the incredible talents that he manifests. Graduating from Boston College, he has spent his career working in government, primarily in the legislature, where during the time that Chapter 224 was debated and written, David served as the Chief Healthcare Advisor to Senate President Therese Murray. I am incredibly excited to have David Seltz come up and join me here to answer GBIO's question, which you should have in your packet, but I'll read it to you. It says, Executive Director Seltz, please share with us 3 guiding principles which will guide the Health Policy Commission in bringing down medical costs. David Seltz.
Thank you, Dr. Addis. Thank you. Good evening.
Good evening.
First, I'd like to say thank you to GBIO for inviting me to be here tonight. Throughout my career, I've been a great partner with GBIO, and as I was sitting in my seat, I couldn't help but notice that in my new role at the HPC, we picked out a color scheme for our agency logo that looks very similar to a lot of the shirts in this room. So, imitation is